Hello, welcome to my YouTube channel. So today we are going to discuss Simman journal approach part 2. Okay, in first video, in our last video, we have discussed the journal approach part A, how to introduce yourself and how to ask questions to the patient and taking consent and chaperone. That all are we mentioned in our first part. If you didn't watch that part, please go to that part and you can easily understand what actually we are discussing here. So in this part we are going to discuss the remaining part of general approach, which is A to E assessment. We are discuss one by one and with an example. So the video might be a little bit longer, so if you stick to the video, you can easily understand the whole Simmen station. Okay, so after taking consent to the patient and tell the patient about the examination, what you have to do is that you will start from airway. Okay, uh, just before starting your examination, you have to watch or look at the monitor, cardiac monitor, quickly. You will have idea that what actually going on with the patient. For example, if his saturation is decreased, might be his airway or breathing obstruction or something like that. Or if his blood pressure is going down, then might be some circulatory issues going on. And if the patient is not if his vitals are normal and he's not talking properly, then might be in disability, for example hypoglycemia or morphine related morphine overdose related issues. So let's start. A is airway. Okay, so if patient is already talking, this means that patient airway is clear. Okay, but still, if his oxygen saturation is below 93 or equal to 93, you have to give him oxygen at this point in airway. Most of the doctors do mistake by not giving oxygen in this part. So this is most important part, that you have to give an oxygen as much as soon as possible. Okay, so but before going to give oxygen, you have to ask about smoker cough. Okay, if the patient is already COPD or smoker cough, then you will have to give oxygen via different mask, not through non-breathable mask. If patient don't have any COPD or smoker cough, then you can give 100% of oxygen via non-breathable mask. So if he's already COPD, you will have to give him through Venturi mask. Okay, and the second thing is that if patient is like having some vomiting, then you can give oxygen through nasal prongs. So in the airway, you have to ask the patient to open his mouth, or if he's already talking, then it's I believe that his airway is clear. Okay, so there are some examples. For example, in anaphylaxis, if his tongue or lip is swelling, then you will have to manage the airway in the first place rather than jumping to the next part, just breathing. Okay, so the second part is breathing. After like clear airway, you have given oxygen 93. You have given him oxygen, and then you will have to move to the breathing part. Okay, in breathing part, what you have to do is that you will have to tell the patient, now I'm going to uncover your chest, Mr. Robert. Would that be okay? He will say, okay, doctor. So you will have to uncover his chest quickly, inspect, just have a look around his chest. Is there a scar mark or any other injury or any rash? Okay, then quickly palpate bilaterally and then auscultate bilaterally and then percuss. After percussion, what you have to do is that you have to check his chest expansion, that is equal on both sides, and then tracheal position. You will tell that now I am going to check windpipe position. Now, Mr. Robert, I'm going to check your windpipe position. So in this way that you have to check his tracheal position, that it is deviate from the center or not. Okay, so the important point is that at breathing, you will have to order ECG, chest X-ray, ABGs. Some people say that ECG should be in circulation and ABGs should be in disability or circulation. But in breathing, all these three you will have to keep. Remember that this will not forget in later steps. So at this point, what you have to take now, I'm going to order ECG, chest X-ray, and ABGs. Okay, so during auscultate, you can find some wheeze or bilaterally clear chest. So if you find any wheeze, then what you have to do is, if you have already given oxygen by venturi or non-rebreathing mask, you will have to change it to, you will have to change the venturi mask or non-rebreathing mask to venturi mask. Okay, there are 3 or 4 types of venturi masks. You can find it, and we will also discuss in another video. So in nebulizer mask, you will have to add some ipratropium, salbutamol, and then start. Okay, understand. So after breathing, in breathing, for example, in asthma, you find bilateral wheeze, or during might be found during for anaphylaxis also. In anaphylaxis, on when you uncover his chest, might be you find some rashes on his chest also. Okay, so after breathing, we are going to circulation part. Okay, so the circulation part is very easy. In this, there are 3 things you have to do. First of all, you will check capillary fill, just pinching his fingers of patient and say that now I'm going to check your capillary fill by pressing finger for a few seconds, and then going to check pulse. You can place your fingers on his to check his pulse, and then also look at the monitor for his pulse. And then sometimes the pulse might be not in regular or something like that, or pulse is very not feel when you check his pulse. So it should be very careful that if you don't feel, then you don't verbalize that I can feel your pulse. Okay, and then check his BP. For BP, just mention that I'm going to check blood pressure, and then look at the monitor and tell the BP is normal or little bit down. Okay, after this, what you have to do is that your task is, there are few tasks. You have to insert IV cannulas and all investigations. Okay, for example, if his blood pressure is normal, then you will have to insert just one large bore cannula. If his blood pressure is below 100 systolic, then you will have to insert 2 large bore cannulas. Okay, after this, if his blood pressure is low, then you will have to send cross match and blood grouping. Okay, all the related to blood transfusion, and you will have to make sure that you order 6 units of O negative blood for any emergency transfusion. Okay, and after this, then you will have to send all the other investigation, blood count, inflammatory markers, or infection markers, cardiac markers, whatever related to that station. By this time, you will get maximum clue what actually going on with the patient. So you will have to stick to that part. So, for example, you think that patient has some chest pain and he might have some cardiac issue. You must say that I'm going to send cardiac markers. While if patient is high grade fever, then what you will have to do, you will have to send full blood count, inflammatory markers, infection markers. Okay. So circulation is here. What you will have to do is that you will have to insert one large bore cannula if his blood pressure is normal, and if his blood pressure is below, you will have to insert 2 large bore cannulas. And if in the circulation part, if his blood pressure is on low side, after send all investigations and insert 2 large bore cannula, you will have to start infusion of normal saline or Ringer lactate, what actually you want to infuse. So this is most important part, that blood pressure should be normal, because in each part you will have to manage that part. For example, in breathing part, if there's wheeze, you will have to start nebulize at that part. In airway, if oxygen is low, then you will have to give oxygen in that part. In circulation part, if his blood pressure is low, you will have to start infusion of fluids at this point without moving to the next part. Okay, and you will have to always check back on the previous part. For example, you are in circulation part and his chest is not good and there is wheeze. You started nebulization, so you will have to recheck after every 1 or 2 minutes that now I'm going to check again his chest. Then the examiner will tell you, or you can find low wheeze or something like that, or the patient will tell you that, doctor, now I'm going to get better. Okay, so come to disability. In disability, what you will actually check blood sugar level. You will find the glucometer in the drawer. You will have to take from the drawer, and then you will have to place on the finger of the Simman. Okay, and then you will have to check his pupils, reactive pupil or not. The examiner will tell you that bilaterally reactive pupil, constricted and reactive pupil. And the temperature. For example, if temperature is normal, the examiner will not tell anything about the temperature. If blood sugar level is normal, the examiner will not tell anything else. If the blood sugar level is low or very high, then the examiner will tell you that blood sugar level is 1.5 or 6.5, something like that. Okay, or his temperature is like 40, 39. The examiner will tell you that temperature is 39 Celsius. Temperature is normal, then the examiner will not tell anything else. Okay, so in disability, what we will check people that, for example, in morphine overdose, or if patient is unconscious, might be his blood sugar level is low, then what you will have to do is that you will have to start management at this point. If his blood sugar is low, what you will have to do is that you will have to give him dextrose solution, which could be 5%, 10%, 20%. Okay, we will discuss the management part of hypoglycemia in next videos, and regarding the morphine overdose, we will have another video in upcoming days. So you will have to start management at this point. Okay, and the exposure part is the last part of A2E assessment. So in exposure, what you will have to do is that after disability, after checking temperature and manage till disability, you will say that, Mr. Robert, now I'm going to uncover your tummy. Just look at tummy and slightly palpate the tummy for any pain or something like that. And then quickly check its private part for any bleeding or anything else. And then go to his legs and expose or uncover his legs for any redness, any swelling, any change in color distribution of his leg. And at that point, you can just check his pulse on dorsal pedis artery. So, and if you have already given him some fluid in circulation part, at this part, what you will have to do is that you will have to insert or catheterize the patient. Be remember, there's no Foley's catheterization in the crash trolley. So what you will have to do is to just mention that I'm going to insert Foley's catheter to my patient to check urine output. Okay, so all the things. And in exposure part, what you can see that if there's acute limb ischemia, there might be some DVT or some you can find any changes in his leg or bilateral leg, then you will have to start management from here. In some other condition, if patient has pain, for example, post cesarean section, pain, the patient will tell that I have severe pain in my abdomen. So when you expose abdomen, there might be some swelling, some redness, some bleeding from the surgical incision part. So what you will have to start your management part from here. Okay, and to understand this part, you will have to watch our previous video, and you can get easily what actually going on. So at the end, thanks to the patient and tell what is your next plan. So in your next plan, what actually you are, for example, patient is hypoglycemia, you will tell after the patient become stable, you will tell that we will keep you in the hospital, and the consultant will visit you, and we will run some other test, and then we will refer you to diabetic clinic. Okay, if patient has some asthma, then what you will do? We will keep you in the hospital, and our consultant and senior will come and consult, and we will run some further tests and investigations, and then we will refer you to asthma clinic. Okay, so this is the Simman part 2. So in our next videos we will discuss one by one, and we will also make a video that what actually the doctors make mistakes during Simman station exam, so we can find out the errors and mistakes made by the doctors, so we can get the advantage of this. So thank you. If you didn't subscribe my channel, please subscribe my channel and share it with your friends. Thank you.